The autonomic nervous system. So many of the drugs discussed in the ANS, or the autonomic nervous system unit, will also be discussed in other units during this pharmacology course. Therefore, just a basic understanding of the ANS information is vital. So learning objectives. So we're going to identify the physiological processes of the central and the peripheral nervous system. We're also going to identify the major classes of drugs that affect the central nervous system. So an overview of the nervous system. So the nervous system includes the brain, spinal cord, sensory receptors. The nervous system regulates and coordinates the body's physiological and psychological functions. The central nervous system is made up of the brain, the spinal cord, that are inside the cranial cavity. Whereas the peripheral nervous system includes all the nerve structures that lie outside the cranial cavity and the vertebral column. So when we talk about sympathetic, that is from the thoracic and lumbar region. These are close to the spinal cord and they're in a chain. Whereas the parasympathetic is from the craniosacral region, and these are close to target tissues. So I want you to look at the parasympathetic and the sympathetic nervous system. So the autonomic nervous system is the part of the nervous system that supplies the internal organs. This includes blood vessels, stomach, intestines, liver, kidneys, bladder, genitals, lungs, pupils, muscles of the eye, the heart, sweat and salivary and digestive glands. The autonomic nervous system has two divisions. As we stated, it has the sympathetic and the parasympathetic. Both of these, the sympathetic and the parasympathetic nervous system, require different responses. After the autonomic nervous system receives information from the body and the external environment, it responds by stimulating body processes. This is usually by a sympathetic division, or they inhibit them, or usually they're through the parasympathetic division. So it's either one or the other. So as we speak about drugs within the sympathetic nervous system or the parasympathetic nervous system properties, sometimes we're going to desire to have an agonistic effect, while sometimes we desire an antagonist, which is the ones that are going to shut off or block the receptor. Remember, agonists stimulate the receptor, and antagonists shut off or block the receptor. Autonomic drugs are not given to correct the disease a patient may have. They are given to stimulate or inhibit the target organ of the ANS. So particularly would be the heart, the lung, the GI system, and glands. So I want you guys to note that some of the confusion with the ANS, or autonomic nervous system, unit is due to many terms that are used interchangeably. For example, if a drug exhibits sympathetic or sympathiomimetic, which means mimics the sympathetic nervous system, it is said to be adrenergic. This is because the main neuroreceptor is ephedrine or adrenaline. It could be norepinephrine or dopamine. These are said to be catecholamines. So the main neuroreceptor of the PNS, which is the parasympathetic nervous system, is acetylcholine. So this is the cholinergic response. So the PNS is acetylcholine with muscarinic receptors and nicotinic receptors. So the two divisions of ANS. So you have the sympathetic nervous system. So the sympathetic nervous system stimulates the vital organs for the fight and flight response. The main neurotransmitter is going to be norepinephrine. And some actions that this sympathetic nervous system includes pupil dilatation, bronchial dilatation. You have increased heart rate and contraction of the rate and force of the contraction of the heart. We're going to have increased breakdown of the glycogen to glucose. And the blood vessel dilatation in the muscle tissues and shunting from the skin and viscera. So a good way to remember this is your fight and flight related to running from a hungry bear. So if you run from a hungry bear, your eyes are going to dilate, you're going to have great oxygenation, your heart rate's going to go up, you're going to run from that bear. You don't have time to empty your bladder and or your bowels, and if you do, you're going to be eaten by the bear. So the parasympathetic system, the parasympathetic nervous system, these drugs are said to be cholinergic effects. They are your rest and digest meds. So the neurotransmitter is acetylcholine, which is an excitatory neurotransmitter. So there's two kinds of receptors. We have the muscarinic, which stimulates smooth muscle and gland secretion, and decreases the heart rate and contractile force of the heart. Then you have nicotinic, which these stimulate smooth muscle and gland secretion. So the parasympathetic nervous system actions include decreased heart rate, increased gastric secretion, pupil constriction, and near vision focus, smooth muscle contractions, increased bladder emptying, and increased bowel function. So with a PNS response, it's time for rest and digest, or we're going to feed and breathe. So there's no time to run, we're going to rest. So when we talk about the parasympathetic nervous system, if it blocks, antagonizes the drug, it is said to be anticholinergic. So if it's anticholinergic, it's now going to exhibit some of the SNS responses, which are adrenergic. So anticholinergic agents that block the release of acetylcholine and inhibit the cholinergic activity, which means they're going to decrease gastric tract spasms and intestinal motility. They're going to decrease the acid production, and it will decrease the associated pain the patient is feeling. So adrenergic blocking agents block the release of epinephrine and norepinephrine, which is going to produce dilatation of the blood vessels and decrease the cardiac output. So drugs that produce effects similar to norepinephrine, so now we're talking about this SNS, are sympathomimetic, the adrenergic receptor agonists. Or they're also known as catecholamines. So the three catecholamines in the body are norepinephrine, epinephrine secreted from the adrenal medulla, and dopamine. So drugs that antagonize the SNS and block the release of norepinephrine or epinephrine, these inhibit the adrenergic response. Therefore, the action is opposite to the sympathomimetic adrenergic drugs. These are called sympholytic drugs. So this chart here is a brief overview. So I want you to also refer to the handout Autonomic Nervous System for detailed overview, which is located on Blackboard. This brief overview talks about the sympathetic and the parasympathetic nervous system, ANS, and their target. So an example, if you have the target is a heart, it's going to sympathetic nervous system, which is the adrenergic, is going to increase the heart rate and force the increase of your contractility. And then you have the parasympathetic, which is the cholinergic. This is going to do the opposite. It's going to decrease the heart rate and force the contractility to be decreased. So you guys can look through that at your leisure. So this right here is a nice little diagram that illustrates an example of the nerve impulse transmission. So keep in mind that the neurotransmitter are chemicals that are released at the end of one neuron and pass across the synapses to activate the next neuron in the chain. So at the end of the nerve chain, the neurotransmitter stimulates an organ or the smooth muscle or a gland to produce a physiological response. So since we're talking about the SNS and the PNS, so the SNS, the norepinephrine, belongs to the class of the natural catecholamines, so your epinephrine and your dopamine. Where when we talk about the PNS, we're talking about the acetylcholine. So the epi and the norepinephrine are separate but similar neurotransmitters. So some drugs are selective, meaning they act primarily on one receptor, and some are non-selective, which means that they are more clinically used but they have increased side effects. Epinephrine can alleviate all alpha and beta receptors, but not the dopamine receptors. So this is just kind of an overview, just to give you an update. So the norepinephrine receptors are adrenergic. So we have the alpha 1. So this provides constriction of the blood vessels, vasoconstriction, and dilation of the pupils. And then when we have alpha 2, this blocks norepinephrine release. So most often when we speak of the alpha stimulation agonist or the alpha blockade agonist, we are referring to alpha 1 receptors. And the alpha 1 is found in the smooth muscle tissue of the peripheral blood vessels and the sphincter of the GI and the GU system, so the gastrointestinal and the gastrourinary system. So the alpha-2 receptors are not big players in terms of the drugs we will be studying here. So alpha-1 receptors in the eyes, the blood vessels, the sex organs, bladder, and prostatic capsule. So it's an activation part. We have pupil mydriasis. You may have vasoconstriction of the blood vessels, arterioles, and veins. So ejaculation, related desulsory muscles of the bladder. It's going to contract the trigone sphincter and constrict the prostatic capsule. So if we talk about alpha-2, receptors that are the nerve terminal or function is a regulatory neurotransmitter. Activation would be reduction of the norepinephrine release. So drugs affect resulting from the activation of alpha-2 receptors for minimal clinical significance. They also may be used to treat like hypertension by decreasing the norepinephrine release. So when we talk about beta receptors, so beta 1, the action of the receptors increase the heart rate and the velocity of the AV conduction, so the force of the cardiac contraction and the release of renin. So this causes vasoconstriction with an increased blood pressure. So the beta 1 receptors are found in the heart and the kidneys, and they treat cardiac arrest, heart failure, and shock. So beta 2, this is the action is the receptor of vasodilation of the heart, lungs, skeletal muscle, relaxation of the uterine smooth muscle, promotes glycolysis, which increases the blood glucose. We're going to increase skeletal muscle contraction, and we're going to block the smooth muscle action. So the beta 2 receptors in arterioles of the heart, the lungs, the skeletal muscle, the bronchioles, uterus for treatment of premature labor, and liver. Beta 2s are the ones that treat asthma. So as a nurse, you will encounter many drugs that have both activated and inhibited beta receptors. Some folks remember to say 1 heart, 2 lungs to help differentiate between them. So just remember that both alpha and the beta receptors are found all over the body. So adrenergic agonist drugs. So these drugs have a similar response to the body's own chemicals. This is a quick overview of some commonly used simple mimetic drugs. So the alpha-1 agonists, this is where you're going to use the epinephrine, is a great drug when the patient needs to have bronchodilation in an emergency. It also helps maintain homeostasis. It helps with nasal congestion. It may be used with anesthesia adjunct therapy, and it will increase the blood pressure. And with the eyes, it will cause the mydriasis, if I'm saying that correctly. So the alpha-2 agonists reduce the release of norepinephrine, and they will decrease the blood pressure. When we talk about beta-1 agonists, these are used to treat the cardiac arrest patients, heart failure, shock, AV block, or patients that have angina. And a good drug for this one would be dopamine, is a good drug that we use for IV to support cardiac output. When we talk about beta 2 agonists, so these are the ones that will treat asthma. So a medication we might use for this one might be terbutaline. So adrenergic antagonist drugs, these are known as the blockers. So the alpha-1 are used to treat BPH. So a common one that I'll probably use would be Flomax, tamsulosin. They also used to treat essential hypertension. Prazolam is a normal one that might use, or called Minipress. Alpha-2 are used to treat phenocyclotomia, which is a tumor of the adrenal gland. So this is the adrenal medulla alteration, which increases the secretion of the norepinephrine. It also prevents the tissue necrosis following extravasation. The beta-1 blockers used to treat angina, hypertension, cardiac dysrhythmias, MI, heart failure. Sometimes they're used to treat stage fright as well. Metoprolol or atenolol are normally the two that are used. So we talk about a beta-2 blocker. So these are non-selective, such as propranolol drug to treat the hypertension, dysrhythmias, migraines, glaucoma, angina, and bronchial constriction. If a patient is using labetalol or Cardival, they block both the alpha and the beta receptors. So the action of cholinergic agonists have many adverse effects that are difficult to limit to specific body parts and functions. Therefore, not many are used in clinical practice. So the neurogenic bladder, a post-op bladder, bethanechol, is a direct-acting agonist cholinergic that stimulates smooth muscle, contraction of the urinary bladder, and it also stimulates voiding. Glaucoma, pilocarpine, is used to reduce the intraocular pressure. And then a medication that will be used for myasthenia gravis, which is a cholinesterase inhibitor. These are drugs that prevent the degradation of acetylcholine by the acetylcholinesterase. So medication neostinum. So this is a reversible cholinesterase inhibitor. And then a patient has an overdose, a cholinergic crisis, and it is treated with atropine, but also used for Alzheimer's disease and to treat the poisons of the muscarinic agonists. Parasympathetic drugs are the anticholinergic drugs. So note that the inhibition of the cholinergic activity or the response is comparable to the stimulation of the SNS response. So these are going to be the anticholinergic that are going to mimic the fight and flight response, but they are not adrenergic agonists. So these are going to be used to treat respiratory and GI disorders. They're going to decrease gastric, intestinal, and respiratory secretions. They are going to decrease gastric spasms. They're going to dilate bronchioles, dilate pupils. They are useful in the preoperative situations to treat nausea. Might be used with scopolamine. Or they might use urinary incontinence or overactive bladder. In this, they may use oxybutynin. So the blocked acetylcholine receptors, these inhibit cholinergic activity. Anticholinergic drugs generally have a very narrow therapeutic index, and they're used in the Parkinson's disease to block acetylcholine or increase dopamine. So comparing side effects, adverse reactions between cholinergic and anticholinergic. So cholinergic, they have diarrhea, they might get dehydration, increase bronchial constriction and bronchial secretion, increase lacrimation, they have blurred vision. So the anticholinergic, hypothermia due to decreased perspiration, urinary retention, decreased appetite, constipation, tachycardia. So keep in mind that the geriatric population has an increased sensitivity to these drugs. So drugs useful in treating urinary problems. So there are various drugs that can treat urinary symptoms related to incontinence, benign prostatic hypertrophy, and urinary tract pain secondary to an infection. So anticholinergic agents are used for urinary incontinence to stop the bladder contraction and decrease the response of some bladder muscles. Antispasmodic drugs directly cause smooth muscle relaxation. Estrogen can restore urethral mucosa and increase the vascularity, the tone, and the ability for the urethra muscle to respond. So when we talk about benign prostatic hypertrophy, this is a non-cancerous growth of the prostate gland that can cause voiding problems. So finasteride, Proscar can be used. Tamsuline or Flomax also can be used. So the action of the alpha-1 adrenergic antagonist decrease the mechanism of obstruction of the urethra, and they will relax the smooth muscle of the bladder neck as well as the prostate. So keep in mind these non-selective agents affect the blood vessel. They will result in a decreased blood pressure. And the therapeutic use are for the patients that have BPH, because we want them to increase their urine flow. Sympomimetics, alpha adrenergic blockers, are selective alpha-1 blockade, resulting in the venous and the arterial dilatation, vasodilatation, and the smooth muscle relaxation of the prostatic capsule in the bladder neck. So the primary treatment is for patients that have hypertension. So an example would be Minipress. Keep in mind this drug can also treat patients with BPH. to decrease the signs and symptoms of urgency, frequency, and dysuria. So when we talk about urinary problems related to anesthesia, or I should say analgesia, the BPH, we might use a medication called pyridium, and it's used for symptomatic relief of dysuria. As a nurse, we need to know that it will stain the urine to this red-orange. It will also stain their underwear to a red-orange if they have any frequency in dribbling. So nursing implications, we're going to learn the history of the urinary problem the patient may have. We're going to find out if there is a diagnosis related to genitourinary disease. Teach the patient how to care for the disease. We're going to have the patient keep a bladder diary, how many times they use the bathroom and the symptoms associated with it, as well as we want to do any drug teaching points, such as if the patient is taking pyridium, we want to educate them that their urine is going to turn that red-orange color. And then evaluation, we want to make sure that the medication is reducing symptoms, but also they need to understand it may take weeks to months. So glaucoma is the leading cause of blindness in the United States. Damage to the optic nerve occurs when the aqueous humorous does not exit the anterior chamber of the eye. This results in a buildup of the aqueous humor, increased ocular pressure or the IOP, and the loss of vision. There are different types of glaucoma. There is primary open angle glaucoma, and there is the angle closure glaucoma. So the simple mimetic or the alpha adrenergic blocker, they produce vasoconstriction and decrease intraocular pressure in the open-angled glaucoma. Epinephrine is a common medication used for the anti-glaucoma medication. So beta blockers, these are going to reduce the intraocular pressure by reducing the formation of the aqueous humors. And the topical beta blockers are used primarily in treating the primary open-angled glaucoma. They also may be prescribed other topical medications to lower the ocular pressure. Beta blockers are occasionally used to treat the angle closure glaucoma, so the narrow-angled glaucoma. So then we talk about the miotics, the direct-acting cholinergic agonists. So the miotics activate the cholinergic system, which reduce intraocular pressure by causing the iris sphincter contraction and the pupil constriction. When the pupils are constricted, the anterior chamber angle is open, and this allows an increase in the outflow of the aqueous humor. So when the acetylcholine esterase is inhibited, the sphincter of the iris contracts as well. This helps facilitate the increase of the aqueous humorous flow. So carbonic anhydrase inhibitors, these are going to block the enzyme of the ciliary body. They're going to cause a decrease in the aqueous humorous secretion. So when the action of the acetylcholine is blocked, the sphincter of the iris is paralyzed, causing mydriasis. It's an abnormal dilatation of the pupil. So the ciliary muscle is paralyzed and the inability to accommodate vision or focus the eye. So the mydriatic